Muted.
Using a new system, if you notice, we're not using WebEx anymore. We're using GoToTraining. And so we have a couple of new things. One is actually kind of a good old thing. You can still chat. So feel free to ask questions throughout in the chat box. We're going to keep folks muted. We do have almost 100 folks on the line, so just for everybody's sound quality, ask questions through the chat box, and then I'll be your voice. So we will do that. And then also at the end, there will be an automatic feedback form, and we would love it if you would take it. I think we just have 2 or 3 questions. Just, was the information useful? How did the format work for you? And that really helps us understand the best way to use your time. So please take a quick second to answer that. And we are recording this. So if you have staff or friends or family who weren't able to join us today, rest assured that when we send out weekly this week, we will include a link to the recording of the webcast so that you can still get that information. With that, I think that we are ready to go. If you're having any problems, again, with your audio or anything, use the chat function. If you can't hear us, try dialing in and using your PIN. There will be a prompt to add a PIN number, and that helps with the audio. So, with all of that housekeeping aside, I would like to introduce our team.
Chris Vandley, Senior Vice President of Advocacy and Government Affairs.
Hi, good afternoon. I'm Claudia Sanders. I'm Senior Vice President for Policy Development.
Greetings, this is Shalene Whitaker, Policy Director for Member Advocacy.
Again, this is Mary Kay Clunies-Ross, your Vice President for Membership and Communications. We are glad to be here today.
So this is Chris again, and good afternoon and welcome to you all. Thank you for joining. I just want to quickly go over the objectives for our call today. We want to discuss implications of the proposed ACA repeal on the state budget and on our other priorities. We want to talk a little bit about the 2017 state political climate, understand what WSHA, we here at WSHA will be working on in the upcoming state session, and then talk a little bit about how you all can participate in advocacy. All right, so getting to the big topic first, the one that I know is dominating a lot of thought both nationally and here at the state level. Clouds on the horizon, talking about Medicaid uncertainty at the federal level, or you could call it Affordable Care Act uncertainty at the federal level, but it's a lot of uncertainty at the federal level, however you slice it. So at WSHA, we've been working, since Election Day, we've been working hard at tackling this issue and making sure we're positioning our organization and all of you to be successful in whatever the eventual outcome is on this. And that started by setting a handful of priorities that the board has approved that are sort of our guideposts for how we will be advocating on this issue. Those are preserving access to coverage. So about 700,000 Washingtonians have gained access to health insurance coverage via either Medicaid or the individual health marketplace. We would like for those people to be able to continue having access to that coverage. We all know how important it is for people to have insurance coverage so they can get the right care in the right place at the right time. We want to promote the stability of the healthcare marketplace, both on the insurance side and the provider side. As we know, it's important for both sides to have a stable marketplace going forward to make the decisions we all need to make for the people we serve. We want to maximize funding for safety net healthcare programs. That's the role a lot of us serve in our communities, and we want to make sure that those safety net programs are adequately funded to meet the challenges of serving our communities. And then finally, and this kind of relates to the stability aspect, if repeal must happen, and we certainly are not for repeal, we are opposed to repeal, but if it must happen, the replacement must come first or simultaneous with the repeal to make sure we the healthcare marketplace and hospitals specifically can have a stable market and can plan for what comes next appropriately. So WSHA's approach, those are our priorities. Our approach to accomplishing this is to focus on preserving the coverage for the nonpartisan data-driven messaging. This is a really key point to drive home. We're not out to take sides in any of the political debates around this. We're not out to protect Obamacare or to demonize Trumpcare or the other way around. We have the goals we've set out, the priorities we've set out that we want to accomplish, and we think the best way of doing that is to be nonpartisan and and to be fact-oriented and data-driven. We want to engage with lawmakers on both sides of the aisle. Again, that's to the same point. We want to talk to everyone who wants to listen about this, because the stakes are simply too big to not be willing to engage with folks. And then other organizational partners, so other provider groups like our friends at the Medical Association and others in the insurance industry and others. We have started a process of working with some of those groups to jointly see if there are areas where we can advocate together or communicate together on our shared goals. We want to be proactive and responsive with how expanding coverage helps our patients and our communities have access to high quality care. We get a lot of questions about this sort of stuff, and we want to make sure that we're there to provide that sort of information and to provide the highlights of the great work that you guys all do out there in your communities, and how it really is a boon to those communities and obviously the patients directly. And we want to support you in communications with your staff and your communities. Mary Kay in a second will detail a few of the tools and resources we're putting together to help, but it's really important for the staff at your hospitals and for the members of your community to understand what's at stake here and to understand the values and principles that are driving the hospital association work on this.
So, thanks, Chris. To that point, I mean, this is no question a federal issue. Is a hot campaign issue. It's a big issue for congressional Republicans. It's a big issue for the president-elect, and actually for the current president, to be totally honest. But when you talk to an emergency room doc or a nurse who works in clinics, you know that it's an intensely local question as well. When we see folks coming in day after day without health insurance, their health is worse. Their families are sicker. There is more anxiety. There's obviously terrible economic toll on a family that doesn't have health insurance, and on a community where there's a lot of families. That becomes kind of a compounding problem. So to that point, we feel like the hospitals should be comfortable and active and engaged in their communities and understanding what's at stake and why we might be taking some of the positions that we are. So to that point, in Weekly this week, on Thursday, you'll see links to our webpage that we're getting up. There will be some data there that folks can use. We're going to be creating a stock PowerPoint that any hospital could use. There's some nice data in there as well. And in the next week or so, we'll have a webcast to talk about this in greater detail, both to talk about sort of our perspective and to talk about how we're going to support you. So I think we've got a good question. I'm going to read it, and then I'm going to look to my experts to answer it. One person said, only chance of having replaced simultaneous with repeal is to have Kathy McMorris Rogers on board. No one else in Washington matters to the Trump forces and congressional leadership. Where does she stand? We've been talking with congressional Republicans and getting a sense of this. I'm going to turn to Shalene, I think, to answer.
So in December, we had a meeting with Morris Rogers, and our hospital leaders conveyed many of the points that Chris just covered about how important preserving access is to our hospital community. And at that meeting, I would say that she listened to our messages. There were no promises made in terms of how this will unfold in terms of repeal and replace. One thing she did indicate that the Republicans were still putting together their strategy on how this is going to take place in Congress after the new year. Chris, do you have anything to add?
Looking up after that is, I think, Kathy, she did make the point of noting that that it's important to her, and I think to her colleagues that they understand that certainly just throwing 700,000 or 20+ million nationally off of coverage is not something they want to do, I think, either morally or politically. So she certainly made that point. I think she's open to listening about these things, but I wouldn't go any further than that.
Shalene, you want to talk about some of the possible changes?
Yeah, so as Chris just said, we heard in our messaging that preserving coverage through the expansions in the ACA is our #1 priority. And as we all know, Washington State was an early expansion state and we set up our own working health insurance exchange and expanded Medicaid up to 138% of the federal poverty level. And as a result, our uninsured rate has been basically cut in half. And there were a lot of campaign promises that were made over the last election cycle around what repealing the ACA, that was the top priority. I think that we are now seeing that in the first days of Congress, the Republicans who now control all three branches of the government are putting in place the mechanisms to make that repeal a possibility through budget reconciliation. And we can all read the newspapers, but just a reminder, the budget reconciliation process does not require the 60-vote majority in the Senate. So the changes to budget items can be made with a simple majority of 51 members in the Senate. So I think it's unclear how this will transpire. There's a lot of discussions about repealing and replacing, and if that, we believe it should be done simultaneously. We may see proposals that would repeal the law and then push the replacement date out, let's say to 2018 or something into the future. Again, we have yet to see any proposals on this. I will say, if repeal occurs and without a replacement, a lot is at stake for our hospitals, but also our state budget. I know that we're continuing to get numbers on this, but one of the ones that we heard recently is that fully repealing Medicaid expansion for our state, repealing the 600,000 people would lose their coverage, and the cost of that to our state budget would be about $2.8 billion a year. So that is very significant in terms of looking at our state budget, and it's really kind of almost in the lines of like the McCleary level of education, this dollars that would take to fund that Medicaid expansion population moving forward in the state. The other piece that's being discussed at the federal level and is getting a lot of attention is around block granting. And again, we have not seen a proposal, but a couple pieces that are being discussed is that the federal government could pay states a per capita amount for their Medicaid expansion enrollees, or maybe their whole Medicaid program, and a cap could be set at a growth rate. I think that in the association's position, we would want to take a look at any of the proposals that come out to see how it would impact our ability to provide or maintain coverage for the Medicaid population. And we would be concerned if there were proposals that would be decreasing the amount in terms of Medicaid that would basically result in a loss of coverage.
So we care a lot about maintaining the coverage, and we want to be telling our story. One of the things that we've gotten lots of requests on are what would be the impact on hospitals financially with repeal. People are very interested in how the increased coverage has benefited Washington hospitals in terms of finance. And this slide here shows there's been a really significant drop in Washington, as one would hope, with more coverage in terms of both charity care and actually also bad debt. As more people get more meaningful coverage, those two lines on this graph, you can see the trends since 2013 are down fairly dramatically, and it is a lot of money. Charity care, which was $481 million in 2013, has fallen to $181 million. So that's a really good news story in terms of both people getting a lot more care, access to a lot more care without worrying about the bills. I think the thing that is not on this graph, and we also want people to be aware of, is that some of that benefit has been offset by the fact that Medicaid isn't the best payer in the mix here, and that Medicaid shortfalls are up. So we also, when we're talking about this, we also want to convey the fact that hospitals are still losing money on a lot of now increased Medicaid business. there's a lot of attention that we've gotten, a lot of requests for people we're working with to get some of this information and to get it in front of, we've had requests from legislative staff. We want to be able to use this information. We think it's going to be important, continue to be important as the debate goes on. This is a number we pulled from information that our members are filing with the Department of Health in their year-end reports. People have been asking us for specific hospital information as well. And so you're going to hear a plea from us very shortly here from me and some of the data folks at WSHA. We're going to send you back your own information. Before we're sharing hospital-specific information, we want to just double-check with you that the information you reported to the Department of Health actually reflects what's going on in your hospital. We know sometimes there have been slip-ups in that reporting, and we want to be able to use this information.
One of the things that I thought was so interesting about how the Affordable Care Act was structured was that we got coverage first, and then we started to see the cuts. So, Claudia, could you talk a little bit about why this is not, how these cuts sort of mean that it's not a big, benefit to hospitals to have this coverage? It's not a whole bunch of new cash.
Yeah, and Julie's going to talk a little bit about what the actual cuts were on this slide, but I would also say the other thing that we're seeing when we look at the overall trend in data is that margins haven't gone up. And so if charity care is going down and bad debt is going down and margins aren't going up, well, what explains it? Well, one thing that explains it is there have been less money coming in from other payers such as Medicare. So with that, Julian's going to go through some of the specific implications of the cuts.
Yeah, so this slide shows the amount of cuts to Washington hospitals over a 10-year period that are occurring through the Affordable Care Act right now and in the future. And these cuts include the Medicaid rate cuts that hospitals took, as well as the cuts to the Medicare and Medicaid DSH programs. And the cuts total about $4.2 billion over 10 years. And as Claudia said, that these cuts were taken to fund the coverage expansions in the Affordable Care Act, Medicaid, and the insurance exchange. And we need both state and federal legislators to really understand that these cuts are occurring, and it was potentially a trade-off for the coverage expansions. And I think that the scariest option and possibility for hospitals in this federal debate would be to roll back the coverage and keep these cuts in place.
All right, well, let me just talk about this. This has obviously been of interest to a lot of folks, not just in the hospital and provider community, but in the public as well. So pretty soon after President-elect Trump was elected, the call started to come in, what is this going to mean for Obamacare? What is this going to mean for Obamacare? Of course, it's a really big law. So we're focused right now is on the coverage. But there's a lot of other aspects of the law that are, either pretty well set into industry practice at this point, are completely uncontroversial or very useful. So we did talk to reporters about the variety of things that the Affordable Care Act does. The focus for us is going to continue to be on coverage, and I think that's where we're continuing to see a lot of media coverage as well. When we post this, you'll be able to click on these links and read these stories, but they do focus on what the coverage would mean, and the how this would happen will really help us know what to predict, but we did focus on the coverage. We do want to continue to keep this story front and center, and we could really use your help. I'll be emailing all the public relations leaders and all the hospitals for this, but I want you to start thinking about it. We know the patient stories are especially compelling, but from the provider point of view, those can just be logistically hard to collect. We want to protect people's privacy and make sure that they feel comfortable in a healthcare setting without being asked to, testify or something like that. But where we feel that we have a really unique story is telling what providers are witnessing as they talk to hundreds and even thousands of patients over the last couple of years. There's also the aspect of the story, how have you been able to change the care delivery model for your patients and improve care based on increased coverage, being able to expand your primary care, or even struggling, frankly, to expand your primary care because that's what the need is. So are you able to keep people out of the emergency room because you're better managing your chronic conditions on the local level? Some of these may not show up in the statewide data analyses that we look at, but you may have an individual story. Does your billing department help people get enrolled? Do they see people being less stressed? Do you know if your community is seeing less personal bankruptcies? Are your small businesses in your area better able to partner in terms of healthcare improvement and also coverage because of what they're able to access at through the exchange? So in other words, what are the concrete ways in which expansion has helped you improve the care that you provide your community? That will help us help reporters tell this story. They can't tell healthcare policy stories every day. That's just not what works for daily news. As interesting as it might be to many people in this office, there needs to be some other ways to explore this story. So we would love it if you had some insight into that and how coverage has helped you care for your organization. So do feel free to let me know, or obviously in any of your conversations with Chris, Claudia, or Shalene, if you've got something that you want to talk about, we would love to help you tell your story. And it could be to legislators, it could be meetings with people in Congress, with staff, or it could just be part of how we create some public standing materials. So we look forward to hearing from you about that. But I do think that reporters have good hearts and have a good instinct for this story and how it's going to affect our community. So this is an important resource.
So before we move on to the state issues, we want to just say real quick that there are a couple other Affordable Care Act related concerns here. And while we're with access coverage, we will say that we are concerned about the unraveling of the individual market, meaning that we believe the stability in the individual insurance market is important for people buying insurance as well as hospitals who take care of patients, and we don't want to see significant disruptions which could occur if the individual mandate is repealed, but the guaranteed issue provision remains on the insurers. I think the other piece that's important to recognize is that there were many innovations and delivery system reforms that the Affordable Care Act helped spur, and we believe that many of those should be continued to be supported.
Indeed. So before we jump into state stuff, we do want to pause for a second and see if there's any questions on what's happening at the federal level and how it might impact the state. Obviously, it will impact the state. It's probably a question of when, but if you've got any questions, let us know. And again, stay tuned because we will be having a lot more conversations and a lot more information about this. So, as I'm not seeing any chats come in at the moment, is there anything else that maybe Chris or Claudia you want to add before we move on?
No, I don't think so.
It's a winding road ahead.
Indeed. All right. Well, thank you so much, and let's talk about the state.
All right. So before we get into the policy side of the legislative session, I know that it may not feel like that we had an actual election here in Washington State as well. It wasn't just a presidential election. So before we get into the actual session, just to go quickly over what's essentially the status quo as far as majority power in Olympia, but yet there have been some important changes at the committee level, which is why we've listed those. So Governor Inslee was pretty easily reelected to his second term in office. The House will still be controlled by the Democrats by a 50 to 48 majority, which is the same majority we had going into the election. A couple of seats switch hands, but it all sort of played out the same. Representative Eileen Cody, who's chaired the House Health Committee for like 18 years or something like that, will continue to chair the House Healthcare Committee for at least the next few years. Representative Tim Ormsby, however, will be taking over as the chair of House Appropriations, which is where all the fiscal and budget bills go through, which we obviously have a lot of interest in. So Representative Ormsby is from the 3rd Legislative District in downtown Spokane. That'll be a new person to work with closely on those issues. On the Senate side, the Senate is still controlled by what is called the Majority Coalition Caucus, but essentially is the Republicans. It is the entire Republican caucus plus one conservative Democrat, Tim Sheldon, who caucuses with them to give them the majority. They actually lost one net seat in the election, and so for the first time in a couple of years, actually need Tim Sheldon caucusing with them to have the majority. Both of the two committees we watched the most closely had changes in chairmanship going into the session. So the Senate Healthcare Committee, Senator Randy Becker, who had chaired that committee for a number of years, is still in the Senate, but has moved on to be in a leadership position in the caucus. So Senator Ann Rivers of Clark County is going to be chairing that committee. She was on the committee previously, so she has some experience in these issues. And then Senator John Braun of the, I believe, Centralia area is going to be the chair of the Senate Ways and Means Committee. Very unfortunately, the chair, Andy Hill, passed away in the fall, so Senator Braun had been the sort of right-hand person on that committee, and he will now be the chair.
Yeah, and I think that over the weekend there was some progress made on the seat arrangement on Pam Roach's seat. Was that right?
I have not actually seen that, but others may be more aware. We have Senator Pam Roach of primarily Pierce County was elected to Pierce County Council, and there's a simultaneous charter amendment, talking about simultaneous, charter amendment to the Pierce County Constitution passed that you can't serve in two elected offices at once, and so Pam has to give up her Senate seat.
Muted.
It was a kerfluffle, though. It was a joint that district spans two counties, and so there was a kerfluffle over between the King and Pierce County councils over seating someone in that seat. And maybe they chose someone over the weekend, and I didn't hear about it. They need to, since Pam can't serve anymore in the state Senate. Just one other really quick thing on this. There's also several new. I won't go through them. The healthcare committees, especially, there are several new members to those committees, not necessarily new to the legislature, though they are in some cases, but just new members of those committees, so that'll be important for us to work with. All right, just a little bit of context for the 2017 session. The budget, it's a budget year, so it's our state's long session, the first year of our two-year biennium. So it's a session where the legislature is tasked with writing the budget document for the two upcoming fiscal years, which for us will be the 2017 to 2019 budget. And under rules passed a few years, they actually have to do a 4-year balanced budget, so only the first two are sort of constitutionally required. So that'll be the main for us. That'll suck. I have heard a lot of people talk about that, combined with the McCleary K-12 funding, McCleary being the name of a court case that mandates we spend a bunch more money on basic education. That will suck the air out of the room on a lot of other topics as they try and figure out how to have a balanced budget. Just for a little atmospherics around that, we're going to just put out a budget with, depending, I've heard actually various numbers cited, but I'm going to go with $4.4 billion in new revenue to help fund primarily education. The Senate Republicans, on the other hand, think that we can meet all of our obligations without a single new dollar of revenue. So that's quite a large gap in a $35-ish billion budget. So that's, we're starting really hard, and that's why a lot of people are predicting that this legislative session will continue for quite a while. As I've already kind of covered, the tight majorities, so neither party will be able to ram things through that their entire caucus are not comfortable with. We've already talked a little about the Medicaid funding and how, especially for the 2 out years, the 2019 to or 2020, 2021 years of the 4-year budget, we could be looking at pretty big budget hits that Jolene covered, if depending on what would happen with the Medicaid expansion funding at the federal level. And just one more item that will kind of be hanging over session. I mentioned that Senator Andy Hill of the Kirkland area passed away in the fall. His seat is being currently filled by an old familiar name, Dino Rossi, was appointed to fill his seat, but that's just for this legislative session. There will be a special election for that seat this November that will be determining the control of the state Senate and determining whether we continue to have divided government or one-party control of all three branches. So that the politics of that will weigh heavily on a lot of the discussions around Olympia.
So, Chris, budget is really going to be important, as you said, with McCleary. It's also true, correct, that revenues are going to be likely up with the Seattle area doing so well, and that they may be waiting potentially for later revenue forecasts before getting down to some serious discussion on the budget.
Yeah, so Claudia, that's a really good point, and one of the reasons everyone thinks we're going to be in session for a long time is the main deadline. Even though it's a 105-day session constitutionally, the actual real deadline that legislators care most about is July 1, which is the end, June 30th is the end of our current fiscal year, and if we don't have a new budget in place by then, big portions of the state government will shut down. So that, you'll recall, a couple of years ago we came right to that precipice before a budget passed, and as happens during that intervening time period between now and then, the state gets periodic revenue updates, and the trend has been positive as far as additional revenue just from current taxing sources coming in, mostly based on an improving economy, although also really heavily based on construction activity in the Seattle-King County area. And the last one of those before July 1 is in mid-June, and that's the revenue update that everyone, legislators will want the most amount of money they can have to deal with, to make decisions with, prior to actually having to do so. So it's very likely that that's why we'll be in session that long, and that's also why Republicans, that's sort of what they point to when they say we don't need new revenue. We actually have more revenue coming in, and we can fund our obligations under that. And I was just to double back, Mary Kay just pointed out to me that apparently Representative-elect Phil Fortunato is now Senator Phil Fortunato. He was elected to fill a House seat, a House of Representatives, State House of Representatives seat. I think he's actually a former legislator as well, and a strong ally of Pam Roach. And apparently, after a feisty process, has been tapped to now jump immediately up to the state Senate. So, question answered.
Sorry for the pop quiz on the weekend reading.
I appreciate it. So, what's on our agenda? So this has been vetted through a lot of you guys and approved by our board. So the number one is preserving access to health care and coverage. So this goes back to the Affordable Care Act discussion and Medicaid expansion. And it's unlikely that we will have actual legislation on this topic, at least from a Medicaid perspective, simply because the federal side probably won't be worked out before session adjourns, though it's certainly not an impossibility that we'll know a lot more. But it's still a matter of what I call conditioning the environment over the next few months, where we're talking to legislators, again, of all parties in both chambers in the governor's office, and making sure everyone's aware of the decisions that are coming, and that, and make sure they're aware of our values and principles that we hope they'll take into account when those decisions come their way. We want to maintain the hospital. We want to maintain the hospital financial stability. This is related to cuts for hospital-based clinics that were included in the governor's budget. We would like for those cuts not to take place. We don't agree with the number from the governor's budget. We don't think it's based in reality, and we think it will limit access to care for Medicaid patients when a lot of times these facilities, these hospital-based facilities, clinics are the only primary and especially specialty care that is willing to serve patients in those areas. So this is a big deal, and we will be fighting hard, and we would encourage, I think we already have a couple of different ways through communications, but we would absolutely encourage you all to be reaching out to your local elected officials, letting them know how damaging that those cuts would be, and if you need any help or information, please let us know. We want to reenact the hospital safety net assessment program. The safety net assessment's been in place for several years now, and we think it's finally sort of a good, stable place, and this is pretty simple. We simply want to extend it out for 2 more years. It's already authorized for 2017 to 2019. We want to, with a few tweaks in the underlying statutory language, we want to extend it out through the 1921 biennium so that the legislature has that in mind for their balancing of their 4-year budget. Improve the mental health system, and I should mention we'll go into a little more detail on some of these, so I won't go through them all in great detail, but we want to, we all agree there's a lot of improvements that can be made in the mental health system, and both through policy and budget bills, we're going to try and make some forward progress. And same with the opioid epidemic, and same with innovative care models. Again, there's no single bill that's going to solve all the problems, but we want to do our best to make forward progress on those. And then staffing flexibility. We're not sure if we'll face any legislation from our friends in the nursing lobby over nurse staffing or break requirements, but obviously it's always something that we want to be aware of and that we'll be looking out for, and we'll be ready to push back against if it does come up.
Yeah, and I would say that we have our legislative agenda online, and there's the link, and you can find that pretty easily. It's also just the reality that things change. Very quickly something might rise as a priority if it's a significant threat to hospitals being able to serve their communities, and we'll always be flexible on that. And sometimes things actually, we see significant movement, and we are able to focus our attentions elsewhere on some of these things. But there's a lot more detail online if you want to read about it.
To the question that came through, Shalene's going to go through mental health stuff in just a minute, so I think we'll tackle that when we get there.
So we're going to spend a few minutes just on the top priorities. A little more discussion. I think we really said basically what there is to say on preserving access to care. I want to repeat, though, what Shalene gave as a figure, because it really, I think, puts it in perspective on this $2.8 billion per year. That would be if the state were to maintain all of the coverage that is currently afforded through the Affordable Care Act on state dollars, and that makes it a really high number moving forward. And so, if push came to shove, I'm not sure that the state would be able to come up with $2.8 billion, which then puts us back to the issue of those people not having coverage. So it's clearly something we're going to focus on as it moves through the state legislative session in response to what happens federally.
Thanks, Claudia. So moving on to Shalene, moving on to mental health. So I'm going to spend a fairly significant amount of time on this slide. Improving mental health for our state remains a top priority for our association, and really our goals center around improving access to care, and especially around integrated mental health care, reducing psychiatric boarding. This is where patients who are in need of involuntary psychiatric treatment basically have no psychiatric bed for their care, and increasing the workforce. So I'll start by talking about integrated care, and WSHA is interested in having Medicaid pay for integrated care within a primary care model that uses a psychiatrist, working with a clinical care manager and a primary care provider to provide mental health treatment. If this sounds familiar, the model is out of the University of Washington and Dr. Jürgen Unitzer's shop there. And we recently saw that Medicare has said that they will pay for care delivered in this way. So we would like Medicaid to do the same thing. Our state has also set a goal that by 2020 that we will have clinical care integrated between mental health and physical health. So we are trying to advance that goal in a meaningful way. Next up, we have care coordination and mental health information. So this is a hot topic around, can we better coordinate care for high utilizing patients with mental health needs? And in our work and in hearing from our members, we have realized that our state law is very limited around who can access mental health information and why. And this is more restricted than HIPAA, and it has caused some confusion. And so to promote better access to care, we are seeking to clarify that care coordination is an activity that is allowed and that a person can access this mental health information to better coordinate care. Next, around workforce shortages, we are continuing to hear from our members that there is a shortage of mental health professionals in our state, and we have developed a modest approach asking the legislature to fund more teaching positions at universities to educate more psychiatric ARNPs. Additionally, we're asking to pay for preceptors who train the students and for some dollars to coordinate the clinical experience, so the students that are graduating and becoming licensed as psychiatric ARNPs can hit the ground running. Another proposal that we are interested in having the legislature fund is around psychiatric rates. Right now, hospitals that open new psychiatric units are not paid like others. They're paid at potentially a lower rate, and we want the legislature to fix this, as well as support the governor's proposal to pay existing psychiatric hospitals and units more for providing those services. A couple pieces I'm moving into are not necessarily listed on the slide, but another law that we are looking to propose and advance this year is relating to certificate of need exemption for psychiatric beds. This would extend something that has been done previously by the legislature to exempt from CN hospitals for psychiatric beds, so we want that continued. The other piece that's going to be interesting around mental health is that we have been seeing a lot of information coming out, and the legislature has been investigating the care at the state hospitals, and it has been maybe determined that there are improvements, to say the least, that are needed at Western and Eastern State. Western and Eastern State hospitals predominantly care for patients who are on long-term mental health commitments, and we saw in the governor's budget that there were significant improvements made around needing to hire staff, needing to make improvements to the facilities within Western and Eastern State to better care for patients. And those two state hospitals are important to us because when patients aren't able to be transferred down to Western and Eastern State, they sit in our psychiatric units, which causes a backup and more psychiatric boarding. So one of the other ways that we can combat this is we have heard from a couple of our members that they would like to serve some of those patients that are needing long-term mental health treatment that are supposed to go to state hospitals, and we would like to see a law that would allow them to contract for those services. And last but not least, we will continue to support capital funding that would allow hospitals and other mental health facilities, not just hospitals, I want to make that clear, that would allow them to make improvements and provide capital funds to bring on more treatment capacity. So we'll continue to push that in the capital budget.
Yeah, thanks, Shalene. As you can see, this is something that we're putting a lot of effort into trying to make a lot of improvements in the mental health system. To answer a question that was asked earlier about the Volt versus a name I can't pronounce, the Melior decision, that's actually where it says the item that says new liability issues. That is what that is about. So I won't go into a lot of detail on this. There's been communication, I believe, with the legal staff at all of your hospitals, but the Supreme Court made an unfortunate ruling right before Christmas that creates a new duty to warn for providers, very broad duty to warn, and an associated cause of action around medical or around liability. So we are working on a statutory fix around this. There's not a whole lot of legal avenues left, though there probably will be a request for reconsideration, but it's, we're not very sanguine that the Supreme Court's going to take that. There's another question around who opposes expanding access for mental health info for care coordinators. I don't know that anyone opposes the concept. It's just that it might cost money. So
yeah, the people who are concerned about privacy are always concerned about providing more information. I think we want to move to the opioid discussion because that's really high on our list as well. We've had workforce, along with WSMA, that has been meeting for many months here, trying to figure out what kinds of recommendations WSHA and WSMA can support, and we want to move some of them through our legislative agenda. We want improvements to the prescription monitoring program so that there will be a notification of a primary care provider when somebody overdoses. Clearly, that primary care provider should know that's occurring, not just the ER doc. And we want the prescription monitoring program to provide us and others with reports on pill use that can be used for quality improvement. So can we get information out that will then help change practices? We're looking for a policy bill, and we're also looking for some financial support for changes in the prescription monitoring program. We're also interested in some dollars that would help support some centers that provide help to prescribers when they have a difficult case. There's somebody they can consult with and find out whether or not there are other alternatives for treatment. Chris mentioned interest in innovative approaches. We have about a dozen rural hospitals that are part of the RAP group. They've been meeting for over a year, and we want to move forward with a new payment and delivery system. It's both a budget and a policy request, and we're asking if there would be some support so that they can continue to provide essential services in their communities. Essential services are the ER, the primary care, and long-term care.
Well, we are going to move things a little bit faster now because we do want to honor your time. And Chris is going to talk a little bit about discharge placement and the importance of people being able to get care in the right place at the right time.
So briefly, I know this is a big issue for a lot of you guys, where you have patients who are filling acute care beds who are medically cleared to be moved to skilled nursing or adult family homes, and yet for one reason or another they are not doing so, and that leads to those beds not necessarily being available for the higher and better purposes that are there for those beds. So we are working to try and alleviate this problem. We're working to we have several options we're pursuing on trying to get the Medicaid managed care plans, and we approach this topic with them to be more diligent and expedient in their responsibilities to transfer patients who no longer need to be in acute care beds to wherever the most appropriate care setting is. On the adult family home side and long-term care side, we're asking for money for the Department of Social and Health Services to fund their ability to move patients to those settings.
Yeah, and for those of you who were on the call with the hospitals and DOH on the flu, this was actually an issue. It has been an issue for a really long time, and you really see it and feel it during flu season when we've got folks who can't move back into the SNFs because it makes it harder for us to adjust to emergent problems.
Yeah, Chris mentioned another really important issue for us is the hospital safety net, which levies an assessment on hospitals that then gets used for more Medicaid money and provides some funding for the state. It's about $150 million a year, and we want that to go on for another 4 years if it goes on with parameters that we find acceptable. And we've had a board discussion about what those parameters will be, and we're going to be proposing a new bill. As Chris mentioned, we also are very concerned about a proposal in the governor's budget, which is to cut payments to hospital-based clinics. There were no health care cuts in the governor's budget except for this one aimed at hospitals. The governor had an estimated $42 million in saving from the impact of not paying the hospital portion of for the hospital-based clinics and only giving them those clinics what would be provided in terms of payment in a private doctor's office. We very much need your help in making the case to your local legislators that the reason that their hospital-based clinics are hospital-based is because they are willing to see the Medicaid patients. There aren't many private practitioners who are opening their doors to Medicaid patients, and that these are very important to preserve access to care, and we need you to weigh in on this.
Okay, so we're working on a couple of issues along with our friends at the Association of Washington Public Hospital Districts. I would just quickly say the larger of the two is the Emergency Medical Technicians Retirement Benefits. This impacts about a dozen or so, mostly small but not exclusively hospitals, and would potentially cost some of them quite a lot of money if the statutes aren't fixed to change the way they have to attribute some of the EMTs they employ within their retirement system.
Yeah, and obviously there are a lot of issues and things that we want to move forward in healthcare that we want to improve. But there's also things that will slow down the improvements that we need to make to the healthcare system. And those are some of the, this is why we advocate for a reasonable regulatory environment. Shalene, you want to talk about that?
Yeah, and so I would be amiss if we didn't mention that we spend significant time making sure that the regulatory environment is something that works for hospitals. Historically, we've opposed staffing regulations. We also saw a proposal last year that would allow ambulatory surgery centers who want to keep patients for more than 24 hours but not comply with hospital regulations. We oppose that. And then we're not sure if non-competes will be back, but we'll be continuing to fight issues that really just don't make sense and are not reasonable.
And then there's also things that we're going to continue to track throughout the session. Oh, and I'm sorry, I accidentally skipped one. Balanced billing is a huge issue. It's got a huge impact on patients, and we're seeking for some more understanding of both the problem and some reasonable solutions. And Claudia is really in a better position to talk about that.
I think the slide sort of says that we are going to be focused on this issue, and we don't want hospitals to have onerous reporting requirements or to be put in a position where they're trying to figure out how to navigate through a dispute between the payers and the providers in their facilities.
It's a good question. Chris, do you want to talk about other issues that we're tracking?
Yeah, and I won't go into detail on any of these. They're mostly self-explanatory. I guess I would report one success already. We've heard that the cardiac and stroke designation legislation will not be coming forward. So we worked with the American Heart Association on possibilities around that. They eventually decided, at least from a policy perspective, not to move forward. And so, success on day one of legislative session is always a good thing to do.
So those are a lot of issues, and we are going to be watching them. Some are going to be important depending on how they play out. I would also say there was a chat question about, are we going to be involved in support for dental care at rural hospital clinics? And the answer is yes. That is also on our agendas as well.
So we'll pause for just a quick second. We've run through as quickly as we possibly can our policy and budget priorities. If anybody has any questions, please feel free to use the chat function. We do have more than 100 people on the phone. That's why we're not going to unmute. But if you can just, just type in a quick question, we are happy to answer it.
Maybe as people come in, we should start to talk about other things, or do you want to pause and answer questions?
Yeah, so there's a question about community benefit mandates, which is a really good question in light of the fluctuating financial pictures of a lot of hospitals. Claudia or Chris, you want to answer that?
Yeah, I think we want to make the point about what we're already doing in community benefits, and we do not want to see, especially at this time, a mandate to do additional specific work. There's, first of all, a lot is uncertain moving forward, but our hospitals are already doing a lot in community benefits, and we want you to be also communicating that to legislators, where you're putting dollars aside from charity care and Medicaid shortfalls, where you're actually making investments that benefit the community.
And then a lot of new and interesting ways too, I think. I mean, I think there's also a health story to tell there. We also got a question about legislation to allow nonprofit and public hospital districts to join risk pools. Is this something? It's not something I know I don't know about. So.
Yes.
Okay.
The short answer is yes. We will be pursuing that.
Excellent. And some of these we may just get back directly to you if you want some more information. Anything else that you guys want to add to that?
Are you aware of any legislators who are talking up the issue of community benefit mandates? No, we are not explicitly this time around. We know that Representative Jenkins introduced something a couple sessions ago. Again, we don't know that that's explicitly going to be back again this year, but a lot of legislators do believe hospitals have done fairly well with reductions in charity care, and really do want to know what you're doing with dollars and your community benefit dollars. And I think hospitals need to make it clear that they are making clear investments and where that money is going.
Great. So we've got some opportunities for folks to get involved, and this is also a chance for us to answer some questions about that you are all asking about how you know when you reach out to a legislator and what needs to be done at key moments in a bill's progress. So, Chris, you want to talk about that?
Yeah. So at a high level, the main three things that you all can do to really help be effective in moving these issues forward is to advocate. You guys are better at telling your story, and frankly, legislators are much more interested in hearing it from you than they are from me or anyone else. So meet with your local legislators and share your stories and priorities. You can testify on bills that matter to you. We try and make sure folks are aware, especially if we know they have an interest in a bill when things are up, but we're always there to help you if you'd like to come testify on legislation. If you can't, but you still want to make sure your voice is heard, call, email, write your legislator. Also communicate internally and in your communities about what's going on in Olympia, about what our priorities are and what our goals are. And then lastly, you can donate. The success stool is a three-legged stool, and I won't spend a lot of time on this. I won't spend a lot of time on this now, but we really we can be more effective. We can have more access. We can talk to more people if we're supporting more people through the campaign process. So that it's a really important part of the process. It's something we're doing really well on, but we could do even better on. And so I would encourage you to donate to the PAC and for others at your organization to do so as well. And I'm happy anytime to talk to you or your exec team or your boards about the importance of that.
And we have gotten questions about specific legislators, which I think would be really well directed to Chris, and that's the type of thing that we're happy to talk to you about if you want to give us a call or come talk to you about in your community.
Absolutely.
There's also a couple of things that we provide as sort of part of that question. So Inside Olympia comes out about every week. You may already be a subscriber. And in that, we'll talk about the bills that are coming up the next week, where we need to have more conversation. Obviously recognizing the great testimony that we get from our folks. But anyways, that's sort of the latest. Our issue briefs are written by our amazing team of policy directors and experts, and you will be able to find those online throughout the coming week as we upload them. But they'll give you sort of the walking around information that will help you understand the issues and help you talk about it. There's also something else that we do that we didn't put up here because we do it as we need, but if there is a particular bill that really needs movement or support or understanding, we will send out a call to action. And what that will do is say, we need you to notify your House member, your senator, and let them know why you care about this bill. And so you'll get those directly. We don't want to pepper the whole world with them every time they happen. Obviously, we have a ton of bills that we're working on, but we'll try to do those in a really focused and meaningful way. And this amazing team is here to help you. Honestly, here's the information that you can contact Chris, Claudia, Shalene. The rest of us on the policy advocacy team are here to support both them and us as we move forward with this session. We will be putting the slides on the WSHA website soon. We'll also be putting the recording of this. So if you just want to share that with other folks, you're certainly able to. There's nothing here that is so sensitive we're not happy to share it. So thank you so much for your time and your engagement. Again, I do encourage you to fill out the feedback form so we can make this the most meaningful hour that you have today. So thank you so much for your time and energy.